we are going to start a topic called heart blocks. Heart blocks, it means a conduction block, not the vessel block. It's a conduction block. So here we are in heart blocks. The main criteria or the main interval of the ECG is the PR interval. PR interval is very much important in this heart block interval. So we should understand that what is a PR interval. It starts from the beginning of P wave to the beginning of QRS complex. This is the PR interval. Normal range of PR interval is 0.12 seconds to 0.2 seconds. That is 120 milliseconds to 200 milliseconds. Next, there are three types of heart blocks. One is the first degree heart block. Next one is the second degree heart block, and third one is the third degree heart block. See, the second degree heart block can be divided into two types later. First degree heart block, all the atrial impulses are conducted to the ventricle but with a delay. There will be a delay. Second one, in the second degree heart block, only some atrial impulses are conducted. In third degree heart block, no atrial impulses are conducted and both atria and ventricle will beat at different rate. Here we have two types, Mobitz type 1 and Mobitz type 2. These are the two types of second degree heart block. Okay. Now we will study the detail about the degrees of heart block. First is first degree heart block. In first degree heart block, all the atrial impulses are conducted to the ventricle but with a delay. Very important point, but with a delay. Each P wave is followed by QRS complex. So the rhythm will be regular. The PR interval is more than 200 milliseconds. We know the normal is 120 to 200 milliseconds, but here the PR interval will be more than 200 milliseconds. That is constantly prolonged PR interval. See here. See, every P wave is followed by a QRS complex. P wave, QRS complex, P wave, QRS complex. So the rhythm is always regular. Here you should understand that from the P wave to the QRS, how many boxes are there? There are one big box and four small boxes. So totally it is 9 small boxes. So to 40 milliseconds into 9, that is 360 milliseconds, which is greater than 200 milliseconds. So we should understand that this is a prolonged PR interval, and that will be constant also. That is constant prolonged PR interval. Next is the second degree AV block. In second degree AV block, we should understand that all P waves are not not followed by QRS complex. All P waves are not followed by QRS complex. That is, all atrial impulses are not conducted to ventricle. Okay, not all are conducted to the ventricle. There are two types. First one is the type 1 second degree AV block, which is also called Mobitz type 1, and second one is the type 2 second degree AV block, which is also called Mobitz type 2 block. The type 1 second degree AV block, that is Mobitz type 1, is also called Wenckebach block. Wenckebach block. Here, the PR interval progressively lengthens until a P wave is not conducted to the ventricle, which means PR interval, normal PR interval, we all know it is between 0.12 seconds to 0.2 seconds. Here, we should understand one thing. Here, the first PR interval, this is 200 milliseconds, that is almost 5 small box. Next, we should see this is the second PR interval, which is about 9 small box, that is 360 milliseconds. 9 small box. Third is P, it is around 14 small box, which is 560 milliseconds. It is 560 milliseconds. So see, the prolongation of PR interval followed by a missed beat block. Here there is no QRS. So this P wave, the atrial electrical activity, it is not conducted to the ventricle. Okay, that is blocked here. So progressively increasing PR interval with next beat is being blocked. That is the keywords here. That is progressively longer PR interval followed by a drop beat. So the patient will be having, it is regularly occurring. See, this is occurring regularly. So there will be regularly, but the irregular pulses. The pulse will be the rhythm will be regularly irregular pulse. Next is the second degree type 2, Mobitz type 2. Here, at type 2 second degree, the PR interval is constant. PR interval is constant. The P waves are intermittently blocked, which is unpredictably blocked, not followed by QRS. Unpredictably, it is not regularly. Unpredictably, it is blocked. Here, the PR interval is 280 milliseconds. Here also, the PR interval is 280 milliseconds. Here also, the PR interval is 280 milliseconds. Here also 280 milliseconds. Like that, it is constant PR interval. But we can see that one third beat is missing. Here, it is a drop beat, and also here also a drop beat. But these are not occurring regularly. Unexpectedly, they are occurring. So we cannot say it is regular. So the keyword is drop in QRS complex. That is a keyword. In this patient, pacemaker is required. Uh, if etiology is not quickly reversible, there are many etiologies for these conduction blocks that we will discuss later. So if etiology is not quickly reversible, they require a pacemaker. Next is the third degree AV block. In third degree AV block, the atrial impulses are not conducted to the ventricle. Atria and ventricle are contracted independently. Okay. The P waves has no relationship with QRS. No relationship with QRS. See here. You can see a P wave. There is also a P wave. This is also a P wave. And this is also a P wave. This is a P wave. These are all P wave. This is a QRS complex. See, the P waves are occurring regularly and the QRS complexes are also occurring regularly, but they are not at all following each other. Okay, after P wave, the QRS complexes are not followed. They are the atria and ventricle contract independently. Here, the P wave, we could say P wave, which is a atrial contraction. The P wave atrial contraction, the rate is 108 beats per minute. Okay, 108 beats per minute. This is a P wave. P P wave. This is constant P waves are there. PP interval. Constant PP interval. And also the constant RR interval. Constant RR interval. The QRS complex here, which is called ventricular contraction, they are occurring at the rate of 28 per minute, but there is no relation with the P, but that is 108, here it is 28. So these are AV dissociation. It's called AV dissociation. AV dissociation. Third degree AV block. Here, the pacemaker is necessary. The pacemaker is necessary. When we should understand that when urgency of pacemaker placement depends on the symptoms, width of QRS complex, and ventricular escape rate. All these are the criteria. So once again, we are telling first degree AV block, there is a constant prolonged PR interval. In second degree AV block, there are two types. Type 1 Mobitz is prolonged, progressively prolonged interval, PR interval. Types 2 Mobitz, there is a constant PR interval will be constant, but intermittently the bits missed bits. Third degree is AV dissociation. Both the P wave and Q all are in a different rate. So we will have some examples. Example number 1, P wave. Like that 2 P wave, then QRS, 2 P wave, then QRS, 2 P wave, then QRS. So here it is 2 P wave, then QRS means the PR interval is constant here. Look at the PR interval is constant here. Is constant. So 2P followed by QRS. So since PR interval is constant, we could say it is a types 2 Mobitz type 2 second degree AV block. So this is a 2:1, 2P and 1 QR. That is 2:1 Mobitz type 2. Likewise, example number 2 is also here we can see P wave. P wave. This is also P wave. Then a QRS complex. Likewise, in this is a lead 2, there is a long rhythm strip. So lead 2, there is also 2:1 Mobius type 2 block. Here we could say that atrial rate 1, 2, 3, 4. The atrial rate is 75 beats per minute, and the ventricular rate will be 38 beats per minute. Example number 3 is 3:1 Mobius type 2 AV block. That is, you could see P wave 1P, 2P, 3. Sorry, 3 P waves followed by QRS. So here it is 90 beats per minute, that is atrial. Ventricular is 30 beats per minute. Similarly, there is also 4:1 types 2 AV block. See the PR interval first. See the PR interval. Is it constant? Check, is it constant? Is it prolonged? Is it constant or is it prolonged? Or it is progressively prolonged? Prolonged. Okay, these are the three things that we should check in a heart block ECG. Okay, then only we can decide which degree heart block is the patient comes. Thank you so much.